Okay, so for debating the best way to ask and educate about trauma, I decided to debate screening questionnaires is the best way to ask and educate about trauma. Three reasons for my position on this is the first one being that questionnaires are a major benefit because it can make clients feel safer. So it can be a safer screening process than just openly storytelling or having a narrative process about this, because it can make people feel caught off guard, uncomfortable, especially if people aren't really wanting to open up and have a discussion. Whereas a questionnaire, someone can check yes or no, but they don't have to go into any detail if they don't want to. And that was from Cole et al. 2023. And then another reason is that clients are more likely to report trauma when they use self-administered screening tools. And so I got that from Center for Substance Abuse Treatment 2014. And so again, it is another safer option, and clients will feel more inclined to check yes or no if they don't have to really talk about anything if they don't want to. And the improvement project described by Lefevre-Rizal et al. 2023 showed that written tools helped providers make individualized care plans and communicate more effectively within the clinic. Not only sometimes midwives can feel awkward with these kinds of questions, and just having a questionnaire can be more direct. It can make communicating more easy, and it can just be more understanding on both ends as well. And then I added one more. According to Michaels et al. 2017, questionnaires were able to successfully screen people for positive results of PTSD. So this can help midwives be able to have a conversation with clients if they screen positive for PTSD, and talk about next steps of how they can help them. A limitation to the screening and education method of questionnaires is that midwives might miss out on nonverbal cues from doing a questionnaire instead of using formal storytelling and narrative trauma inquiry. And I found that from Isabel 2023. And it's true. Sometimes when we just have clients check yes or no, we aren't able to openly discuss things because they don't want to, and so we do miss out on tightening fists or tightening muscles or looking away or avoidance, those kinds of things. And then trauma experiences from the list in 15.1 that I might leave out for questionnaire. One of the ones I chose was intimate partner violence. And one of the reasons for this is because today a lot of clients do come to their appointments with their partners, and so it could be a really sensitive topic, and it could even cause harm after the appointment, and they might not want to answer it, or they will lie about it because it's not something somebody really wants to talk about in front of their partner if there is any kind of intimate violence happening. So a quote from the Lefevre-Rizal et al. 2023 is, they're not going to be able to divulge anything while their partner is there, especially if their partner doesn't know about it, and sometimes that is the case, end quote. And so that also leads me into my next one from 15.1 is a sexual assault. Sometimes partners don't know about that, and so someone's not going to want to answer that question truthfully if their partner's in the room, because one, their partner might not know about it, and two, it might cause their partner to get upset. They don't want to talk about it either. So that is my stance on why I chose to do the questionnaire screening, and I will provide all of my 5 resources in a separate document in this assignment as well.